Hi ladies, hi mothers out there. Are you prepared for this medical emergency? Hi everyone, so I've got my notes ready, my book, and I've actually researched a lot on this medical emergency. I have also first-hand experience with this kind of emergency as a resident pediatric doctor in the hospital. So I have kind of good background for this one. However, I just want to put it out there that this is no way like a know-it-all video. This is just like an overview of things, and hopefully this will help some mothers or somebody out there. So this medical emergency that I wanted to talk to you guys about or discuss about is regarding allergies and severe allergies known as anaphylaxis. So what is allergy? Allergy is basically being sensitive, your body being sensitive to certain substances. And the triggers can be food, as I mentioned, like peanuts, shellfish, medications like ibuprofen, penicillin, and other antibiotics out there. You can also have an allergy to bee stings, venoms, ant bites, and all that. Even infection, like if you have urinary tract infection, other kinds of infection can also trigger an immune response called an allergy. So there. These cases of allergy can be from mild to severe. Mild allergies, I experience it myself. I have skin asthma. My daughter has skin asthma. Like mild allergy can also be allergic rhinitis, watery eyes, and all that. Severe allergy is very life-threatening. It's called anaphylaxis or anaphylactic shock. This is sudden. You can die within minutes, even like die within 15 minutes. And this is very scary, and we should all be prepared for this kind of emergency. So what are the signs of mild allergy? As I mentioned, rhinitis, so watery nose, red eyes or watery eyes, hives, rashes, flushed skin, and what else? Wheals can also present, can also be like a mild form of allergy. However, if these wheals become bigger and more generalized, and you can see swelling of the eyes, nose, lips, and tongue, or you feel like your throat is swelling up, that is a severe kind of allergy or anaphylaxis. What are the other signs of anaphylaxis? Difficulty of breathing because your throat is being constricted because it's swelling, and difficulty of breathing, difficulty swallowing, as I mentioned, wheezing, like you're purring like a cat, like if a person with asthma knows how this is. Like you're breathing through a very tight airway, that's why you're making a wheezing sound. What else? Rapid pulse or palpitations, feeling of apprehension or anxiety, like a sense of doom coming because of the palpitation. That's also a severe sign. Nausea or vomiting, diarrhea, severe abdominal pain. What else? Weakness. I think I've mentioned like an overview of what severe allergy is. So what do we do about this? For mild allergies, of course, the first thing is determine the cause. If it's a bee sting, try to remove the sting with something like a hard plastic, like using a credit card. Because if you squeeze on the stinger and you don't remove it with a hard plastic thing like a credit card, the stinger can actually induce or release more venom, so it will cause more allergy. Like using a tweezer is not advisable. You have to like scrape it with a plastic, like a credit card, plastic something. So determine the cause. If you have like an over-the-counter stuff, like over-the-counter antihistamine, I will show you. I always have this. I have my Benadryl and my cetirizine. So if you have that, you can give that. We're talking about mild, okay, mild allergy. So this is oral medications. You can also give nasal decongestants, but it's more advisable, of course, after giving all this, to call for help, seek medical help. What else? Because you have to seek medical help because these symptoms, like, you think it's just a mild allergy, but it can go on to severe allergy, and you need medical help for that. If you have EpiPen or Twinject, something like an epinephrine, then that's also good. But for mild allergies, let me tell you, you don't really need that. Like for rhinitis, you don't need an epinephrine or EpiPen for that. Okay, let's talk about severe allergy or anaphylaxis or anaphylactic shock. Of course, if your child is suffering from that, always check the airway, check breathing, check the pulses. That's important. If you have a basic life support class in your area, go and register for it. When I was in Indiana, in Terre Haute, Indiana, I actually did my basic life support there, in the regional hospital there. It's very helpful for you to get those classes. So for the airway, you have to protect the airway. And how do you protect your airway? First, you position the head. I will show you a picture in the proper way to position the head. Do not use any pillow, because if you use a pillow, it will just block the airway. So remove the pillow. And then if the child or the person is vomiting, put them on their left side, left side, position them, and so that they will not choke or aspirate, and that because if they aspirate, it will worsen everything. So there. And then, of course, call for help. Call 911, call your relatives. I will show you my emergency kit. I have a card there where you put everything there, like phone numbers, ambulance phone numbers of relatives, friends, people you can call, and not just 911, because here in the Philippines we don't have 911. So I have my relatives' phone numbers, everybody's phone numbers there, even our neighbors, and hospital phone numbers and all that. That's important. So call for help. And then in your emergency kit, while waiting for the ambulance or 911 to arrive, it would be great if you have these things in your emergency kit. First, if you have family history of asthma or any allergy, your doctor, I'm sure, will be providing you with EpiPen or Twinject, something like that. However, in the Philippines, that's not available. So I'm a doctor, so I know how to use this. So I have some nebules here of epinephrine. So there. And then always take note that if this is a severe allergy, do not give anything. Like oral medications is a no-no for persons with severe allergy, because this can just cause choking, vomiting, and aspiration. It will worsen everything. So everything should be injected. And then if you have a nebulizer, this is a great tip for you guys. Nebulizer is not just for asthma, it's also for severe forms of allergy, because albuterol, well, here in the Philippines we have salbutamol nebules. This is what it looks like here. We have this. This looks like ancient and like Jurassic, but we've had this for a long time. It's still working. Some of our family members have asthma, so we have a nebulizer at home, and we have the mask for the children, for the mask that you attach here. It's best if you, while waiting for the paramedics, if you can nebulize. This is important because beta-2 agonists or salbuterol or albuterol can help with the constriction of the throat. So there, it's rapid. It will relieve, hopefully, after injecting your epinephrine, you can nebulize with this while waiting for the paramedics. What else? Prevent shock. And how do you do with this? But of course, before you do this, make sure that there's no injury, like spine injury, back injury, head injury, leg injury, or anything like that before you move the person. But if there's no injury whatsoever, elevate the legs, position the patient lying down, elevate the legs so that the circulation, the blood will go to the heart. And then keep your baby or your patient or whoever is having this allergic attack, keep them warm, cover them with warm blanket. Even if you're outside and you don't have a blanket, use your coat or something like that to cover them and keep them warm. So there. Now, if you, for example, you are at home and you've given your injections, you've given your nebulization, and you seem like your patient is already well, the person having the allergic attack is already well, still get medical help. Seek medical help, because symptoms of anaphylaxis can recur even without the trigger. They can recur within 24 hours and you can have another severe attack. And so we actually advise people with severe anaphylaxis that they should be admitted. Even if they're stable already at the emergency room, we still admit these people because they need to be watched, because as I mentioned, symptoms can recur, so that, you know, you're in the hospital setting, you're safe there. And then in the hospital, they will also give you steroid injections, drips, there. So, of course, as always, prevention is the key. Know your allergies, family history of allergies. However, even if you're very careful, accidents can still happen. So you should always be prepared for this kind of situation. So that is my discussion, a very quick discussion, you guys. This is just an overview. This is not to replace any formal instructions, I would say, on allergies. This is just an overview to help you guys if you want to build your, your medical emergency kit. This video has been so long already. I wanted to show you my kit, my emergency kit at home. However, this video is so long already. I will probably make a video on my emergency kit in my personal YouTube page, and I will just link it down below so you can check it out. So there, guys, thanks for watching. Hope you enjoyed watching. Bye.